Okay, now it's time for the gallery abominant. So let's start here. We've seen this guy before, just a little bit earlier. I think it was something about the medial canthal tendon not making it all the way to the infraorbital furrow. But there's another problem, and we can look now down at the mouth and see if we see anything that's problematic there, because we've talked a little bit about that. And there's actually two things that I see. And one is this big cavity between the infraorbital furrow and the nostril, right? Just a little bit too heavy-handed in there. This needs to progress just a little bit more closely, right? It doesn't need to be a sharp furrow, right? But it can be just a gentle plane change. But I think this guy has just been a little bit, maybe he was a little bit worried about making it too sharp, and as kind of doing the opposite, he made it too kind of deep and too rounded. But the other kind of bigger problem is, for me, the modiolus, right? And we've looked quite closely at that. That's kind of how the corner of the mouth terminates, right? It wraps out into the modiolus immediately. It doesn't come to a stop, a point, and then some skin, and then the modiolus, right? It comes to essentially the skin, that the corner of the mouth rolls out into the modiolus, right? They're one and the same. The corner of the mouth is the modiolus, right? It's the pulling point for all these muscles, right? So all this stuff has to kind of, there's quite a few actually when it comes down to it. And so yeah, it yanks right on the corner. So there's just a little bit of space that has to be closed up there. Okay, let's look at this guy. This guy has the problem in his lower mouth, right? I suspect his teeth are, his mouth opening is too small for one, right? I expect his, well, it's hard to say, to be honest. There's funny proportions. It might just be that his vermilion is so small. But the main problem with this one, for me anyways, is to do with this this kind of chin region, right? And we've seen this design pattern where, you have your lips, and then you have this nice kind of shape from depressor labii inferioris. But this whole thing, this kind of W-ish shape, necessitates or requires having a chin bump right in the middle, and then kind of descending below those you have depressor labii, because these guys are going to the angle of the jaw, right? And unfortunately, on his particular construction, you have depressor labii and is going into the chin, right? Essentially, this chin fat is sitting on top of, just below the mouth. It would be like, in this view, if my chin was this big, instead of going right in the middle. So essentially, this guy needs to get this shape right, instead of having these sit up, right? There's no overlap between them, right? This is all sitting on top of the chin. If I erase one more time, what we want to see is, we want to see these come below the chin, right? The chin is kind of interlocking in between it. That's giving us form out here, and giving us form here. And in fact, then you have kind of the forms here. Okay, that's really what we want to see. And then again, like, he's clued in a little bit. He's got the jowl located in the right place, right? So this superior mandibular jowl, or whatever this we call this first one, is hanging in the right place. He's almost got the good jowl coming from off of the node up here. He just needs to nail this a little bit better. Okay, next we have, well, the Hulk, right? We're quite used to seeing the Hulk, versions of the Hulk in the figure anatomy gallery abominant. But unusual that he's in for facial expressions. So what is this about? And might have to do with the teeth, but these teeth look fine for the most part. But I have a sneaking suspicion that if the Hulk closes his mouth, he is almost certainly class 3 maloccluded. Look at this massive underbite that the Hulk has, right? And class 3 malocclusion, while tragic, is okay if you're class 3 maloccluded, but if you're just doing it for fun, it's not so cool, right? And look at that. If he smiles, he's not class 3 maloccluded. So which is it, Hulk? Underbite or not? So I think probably what's going on here is somebody who's animating the Hulk has used this as part of his facial expression. He does a huge snarl and projects his lower jaw forward. I'm not sure. I would have to see the animation, but try doing this yourself. Try clenching your jaw, so masseter fully contracted, but have your jaw projected forward and do a snarl at the same time. I'm not sure that all three work together, especially the artificial projection and clenching of the jaw. I have a hard time doing it. I'm trying right now. Okay, anyways, Hulk, questionable whether you're the Gallery Abominant or not. You're well done, so you're on the edge. Now, the next one is a little bit sad. Again, you hate to drag in somebody as famous as Caravaggio into Gallery Abominant, but if he's not holding, if it's not up to scratch, you know, this is equal opportunity for everyone. No exceptions, just for massive fame and fortune in your day. But you put this forward, you know, I think almost anybody with a semi-trained eye could look at this and say there's some construction problems in the jaw, in the mouth area. And I'm not going to do a full reconstruction, but if we kind of just think about what we know so far, right? Kind of orbits, zygomatic arch, you know, the sunglasses. You know, this upper part is fine. It holds together pretty nicely. But then if we kind of take this back edge here, this is up by the ear, right? We have our temporomandibular joint. We take that and we know the jaw's open, so we have to dislocate the mandible a little bit and then pass it down, pass it forward. And on this side, we don't quite see it, but if we wrap that around, it's going to be coming back like this. I'm going to put the teeth going more like this to the side, right, which makes sense because the nose is pointing forward, kind of 3/4, redesign the lip. Mouth might have to shift over like this, and this line from zygomatic arch down to the chin has to just kind of go a little bit flatter, right? And we can put the thickness of the lips back if we want, but essentially we have to shave off a big chunk out here, a big chunk of jaw, and a huge chunk of jaw down here in order to get this to work. And I put this one down to lack of construction in general, and specifically kind of doing the right thing with the mandible in kind of an open mouth position. Okay, so I'll just erase that, and you can see that this in particular is quite problematic, and as well as the orientation of the mouth. Okay, so I think that is it for the Gallery Abominant this week. Short and sweet, a few nice little pieces to look at. Again, good ideas for what not to do. Okay, so all for now, and I will see you guys again next week. Thanks.